Just want to welcome everybody tonight to our presentation, which is on safety at Robinwood. Our main purpose here tonight is to talk about health, safety, and injury in Little League Baseball. My name is Jim Jackson. I was a practicing orthopedic surgeon for about 20 years, and I specialized in sports medicine, athletic injuries, and took care of young children, adults, elderly adults, you know, the full spectrum. I did focus on sports-related injuries. I was fellowship trained in Hawaii and also in Los Angeles on sports injuries, so that was my focus. And I really love sports like everybody here, and I'm very happy to be here this evening. I'm going to present this talk in 3 parts. The first part is very important. You may think it's a little bit dry to start off with, but it's the history of Little League Baseball. The middle portion will be some details in regards to some of the safety innovations that have been performed and instituted over the last several years, many years actually, by the league. And then the last portion is going to be demonstrations of certain types of injuries that can occur during and on the field of play, and how we can approach some of those so that our kids are treated properly, expeditiously, and end up getting the care that they need. So, what about the history of the Little League? Well, it was founded all the way back in 1938. Carl Stotts is the person who founded the league. 1938 is a significant year. As you know, that was the height of the Depression, which lasted through the 30s, and actually didn't end until the beginning of World War II, 1941. But at the time, the mission, believe it or not, had little to do about baseball. The mission was to provide a program of service to youth during the Depression. So a quote from Carl Stotts was, and I quote, "It's an outlet of healthy activity under good leadership with community participation dedicated to helping children become good and decent citizens." So if you think about it, you put yourself back in that time frame, a lot of people out of work, a lot of kids roaming the streets, severe poverty, and it was initially a way to organize the kids, have mentors and leaders to help guide them through a difficult period in our history. The first piece of safety equipment was developed in 1961. It was by Dr. Hale, and it was the helmet. And the helmet has gone through a tremendous amount of evolution since that time, and I'll show you some examples. One very important thing that really solidifies the importance of Little League and how it goes well beyond the game of baseball is the fact that in 1964, Little League Baseball was awarded a federal charter, which is the only youth organization, including all the soccer, all the football, everything else. It's no other organization is federally chartered, and it is based on not just the game itself, but the principles upon which it was founded and how we institute them. Well, why are rules implemented? Nobody likes to have changes or likes to learn a bunch of rules, but let's face it, rules are necessary in order for the game to be played correctly. But in regards to what we're doing here this evening, it's for the safety of the kids. Little League rules are implemented to help improve safety. The revisions occur when reducing injuries are a concern. So as Little League has gone on, the impetus for making a change or creating a new rule is really based on factual information that has occurred, database collected, and then that is presented to the National Little League and then they have their own board, and then they come up with solutions on whether or not a change needs to be made, a new rule, modification of an old rule, or even a deletion of a prior rule. So what are some of the implemented safety rules? Well, I told you about Dr. Hale, who in 1961 developed the first helmet. Well, there are base coaches. Think of the value of base coaches. What they do are they're an extra pair of eyes at first and third base for their child. They don't have to turn around to look where the ball is. They can pay attention on running the bases. It's a protective factor, not only in the strategy of the game, but helps them to round the bases more safely and to avoid injury. Synthetic spikes. The old spikes were metallic. They created piercing injuries, lacerations, cut tendons, crushing injuries, lots of things that created significant disabilities to the kids. So now the synthetic cleats are what we like to see and are mandated, and they usually are rubber or a synthetic type rubber spike. All kids are required to wear a cup, and that includes all the way down to the 4-year-olds in T-ball, all the way to the top of the senior league. Things that you don't want to do and that you cannot do. Head first sliding. No on-deck batting. Does anybody here know the exception to the head first sliding rule?
Yes, I believe I do.
What is your name?
Mark.
Mark.
Yeah. I believe you are allowed to slide head first when if it's a pickoff play.
Correct. So basically the rule is the child can make the base that he's headed to. Once he gets there, if he wanders off the base or is caught in a pickle or a rundown and is trying to get back to second base or first base or third base, he can lunge hand first to touch the base. But if the child is instituting the steal, let's say from first to second base, it has to be a foot first slide. Does everybody understand that? Okay. Very good, by the way. All right, some of the other things. On-deck batting, as you know, is very important. I could even testify my own daughter at the time when she was playing softball as a young child. She was 5 years old. She was walking up to the plate to bat. The on-deck batter swung the bat, hit her in the chest, knocked the wind out of her. She was taken to the hospital, and she stopped playing softball as a result because of the fear of returning to the field, and she did not return for 5 years. Since then, the rules have been changed in softball as well. So there's only one batter on the field. That's the person who is going up to bat. And very, very important. There's a criminal background check. As you guys all know, you filled out a volunteer application. We make sure that our mentors, which are coaches, our managers, our assistant coaches, and our team moms or anybody else that has contact with the kids have a solid background. We have disengaging bases. Most of you are aware of that. On the lower levels, they are a plastic, almost like a suction cup fit, with 3 to 5 pounds of force will knock the base away, so that helped to avoid leg and ankle injuries. Up at the upper levels, the juniors, they play with more of a harder fixed base. It's a magnetic surface, 2 metallic surfaces, which requires a slightly greater force. They're larger kids, in order to dislodge the base. But again, for safety, to avoid leg and ankle injury as well as sliding. Catcher's helmets were introduced. They've also gone through an evolution. You have the standard catcher's mask. A lot of people now wear a hockey-style mask, and I'm going to speak a little bit more about that. One of my greatest mentors while I was training as a sports medicine fellow was a gentleman by the name of Jimmy Andrews, who has a sports medicine practice down in Birmingham, Alabama. James Andrews is a sports medicine trained orthopedic surgeon who is really the #1 expert in the country on elbow injuries. He also happens to be on the national board of Little League in regards to instituting certain rules on helping to protect the kids from injury. His greatest contribution was in 2007, he instituted the pitching count. So, and this is all based on factual data. They created a database. They were able to figure out what number of pitches are acceptable for a certain age child, the amount of rest that's necessary based on the number of pitches, the number of days. And it's still undergoing some modifications, but basically it has worked very well. And the extent of elbow injuries has been dramatically minimized. I could tell you I've been involved with Robinwood for many, many years, and you just don't see the elbow injuries that you used to see because the kids' elbows are not getting worn out, and they can. And it's one of those great rules, and Jimmy Andrews is a very smart man. Then in 2008, I think all you guys remember back, there was a big deal about baseball players and using steroids, human growth hormone, other performance-enhancing drugs. So Little League Baseball tried to stay ahead of the curve a little bit on that and put together a PED program, performance-enhancing drug program, and the name of that was called I Won't Cheat. And that has been in play ever since, and thus it is a good rule to help to stay away from such things. All right, what about bat rules? BPF, bat performance factor. What it is it's a test where the company and Little League take a bat, they take a baseball, the baseball goes at a certain velocity to the bat, and then they measure the projectile, how far the ball goes, based on a certain velocity, which means how fast the ball is going. And then they gauge that against a series of bats. And they determine how the bat performs. And it has to be at 1.15 or less. All of the bats have to have a BPF labeled on them of 1.15 or less. This year they came up with a new factor called the acceleration factor. And the reason why they came up with that is because the distance that a ball comes off of a bat isn't the only thing that's important. It's not just the fact that you could take a ball and you could hit it farther, but it's how fast does the ball travel in time from one point to another point. How fast does it get there? How fast does it accelerate? And the reason why the acceleration factor was incorporated is because of the fact that some of the composite bats, which are the ones that are made out of a woven carbon fiber, which have become very popular in the last few years, that after they become aged, the older they get, the stiffer they get, and the higher the BPF. But the acceleration factor became very important because the reaction time of the pitcher stands there, winds up, pitches the ball, comes off the mound, ball hits the bat, comes towards the pitcher recoils to stand up, doesn't have time to get his hand and his glove up. So guess what happens? He can't protect himself. Ball comes straight at him, could hit him in the chest, could hit him in the face, and could create a trauma because the pitcher effectively becomes defenseless, which is why all of these factors have come into play. Okay, some basic things on baseball bats. Barrel size. This happens to be an aluminum bat, so there really isn't any question about the composite nature of it. It's a single casing aluminum bat. The barrel size is indicated on here. 2¼ inch barrel. Has to be 2¼ inch barrel, cannot be any larger than that. Pony League, all the other leagues use the big barrel bats, You cannot do that in Little League. Little League label. The pointer is right on it. Little League. You see all the other leagues in there. We don't care about those. The only thing we care about is that it says Little League and it has the trademark next to it. As a matter of fact, for all the freshman coaches and managers that are here, before each and every game, you're going to be lining up your equipment in front of the dugout, all the bats, all the helmets, and the umpire in charge is going to go down and inspect every bat and every helmet for integrity and to determine whether or not the bats are legal or not. And if they don't have a Little League label on it, I guarantee you it will be removed from the game. Okay, here it is listed on the bat, BPF, 1.15. So you know you've got a good bat. It's got the BPF, Little League insignia. It's a single 2¼ inch barrel, and it is an aluminum bat, totally acceptable to use. All right, here's what I want to show you, why it's important that new rules are being instituted in regards to the bats. This is a picture of a chest wall. The little blue pointer is pointing at a rather thin structure called the sternum. Some people call it the breastbone. Directly behind the breastbone is, guess what structure? The heart. The heart sits directly behind the sternum. So what happens is that, I just showed you, we have our kid pitching, follow through, starting to come up, can't get his hands up to block the ball, accelerated ball, hits him in the sternum. And guess what that can cause? It could cause sudden cardiac arrest, where the heart stops and the child dies, unless certain measures are instituted. CPR, and actually electric paddles can also be utilized to attempt to revive the child, but it's a problem that, you know, fortunately we haven't seen, and hopefully we will not see, but this is the reason behind the acceleration and the bat performance, you know, in addition to minimize facial injuries and so on. Another structure that can be injured is the trachea. Trachea is like thin, like an eggshell. If it's broken or cracked, you can't really put it back together. And what happens is the air leaks out from there. The child has what's called emphysema under the skin. The air starts to balloon under the skin and they can't breathe. So a fractured trachea could also be a lethal injury. So who are the people who are most susceptible to get that?
Catchers.
Exactly. Who said that? Right. Because the catcher is always sitting behind the plate, and the fouled balls are the ones that they do not have time to react to, and the only area that tends to be unprotected, aside from the top of the thighs, although our equipment has extended thigh protection, is the front of the throat. This is a larger view of the trachea, and this is the cartilaginous structure that actually gets fractured. So you got to wear a throat protector or a throat dangler. This happens to be one of the hockey type masks. In all honesty, I'll tell you something. I think the more traditional style mask is a lot easier to use. It's easier for the kids to get off of their head. It's easier to put a throat protector on. But even with the hockey style masks, here it is. It's the thing labeled Pro 9. It dangles down below the mask and it protects the larynx from being fractured. Absolutely mandatory. All masks have to wear this. Helmet safety. Well, Dr. Hale went ahead and came up with the first helmet, but there's been a lot of changes. The ear flap is very important. It protects the ears and what's called the temporal side of the head, which is almost paper thin and can be damaged by a baseball. Most of the ear flaps now are constructed with a hole like this one is. It has different functions. Hole number 1 allows you to hear. If it's just solid, you can't hear, right? Number 2, aeration. Number 3, most kids like to pull off their helmet by pulling and lifting. Padding and fit. Fit is important. You don't want to have a child running around the bases with a bobbling helmet where they look like a bobblehead. You want to make sure that the fit is good. A lot of the kids nowadays are getting their own helmets, which are fine. We have some helmets, but if you'd like to get your own helmet, that's fine. All the helmets now, or the overwhelming majority of them, come with multi-layered padding. As you can see on this one, this happened to be my son's helmet. It required 2 layers. You could see the line in between. 2 layers of padding to fit him properly so that it was a snug fit. That's how the fit is obtained now, is by the layers of padding. They will give you 1 set and then a second set. Too big, you add the second layer. You could do it piecemeally if one area needs more fit or not, but you could, go ahead and do that. All right, how about ball safety and regulation? All right, this is, actually I had just finished a cup of coffee here, and I put a ball on top of the cup, and the reason why I did this is to show you the type of ball that we get at Robinwood, because we're concerned about our pitchers. The seam here, what I wanted you to do is to be able to project across and take a look to see how high the seam is raised above the baseball. It's called a 1/3 seam. The 1/3 raised seam has been shown to cause the least amount of abrasion, blister formation, nail splitting, or any other injury associated with using the seam to put action on a baseball. The 2/3 and full seam baseballs that you see up in the major leagues, you see those guys, they always have blister problems or split nail or whatever, and it's because they have a tremendously higher seam that causes injury. So we stick with the 1/3 seam baseball. It's the safest and still allows the kids to do what they want to do with the baseball. There are legal balls and illegal balls. Again, legal, Little League documentation on there, Little League emblem, Little League copyright logo. So you take a look at the ball to the right. It's got it, doesn't it? How about the ball to the left? Forget it. Official NFHS? No. Here's another view of the baseball that lets you take a look at the legality versus illegality of the ball. The ball on the left, sure, it has a proper size and weight, 9 inches, 5 ounces. Both of the balls do. But look at the ball on the left. It doesn't really describe it except for what the ball on the right, a little bit light, but look what you can see right up here in this designation. My reflection kind of hit it a little bit. I'm sorry about that. But it's right here. It says LL1, Little League 1. There will be balls that will be labeled OLL, or OL, I should say, which basically means all league. LL is Little League, so that's another thing you want to look for. So this is the right ball. Little League, emblem, LL1, and we use a 1/3 raised seam. Field safety. A few things to discuss here. This is really important. As a matter of fact, I think this is my most important slide. A few days ago, I was down at the field, and before I left, I decided to take this picture. It's a picture of me holding my cell phone and walking up toward the park. We tend to get so caught up in our cell phones. We're texting, we're talking, we're blah, 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 and we don't take a look at what's around us. We are all part of this open campus. So it's better for us to pay attention to our surroundings by being observers and putting the phone away, not just going straight to your field, but taking a look around. Be an observer. Does everything look right to you? Good. You know, if it doesn't, you're going to want to mention it to somebody. You see an injury or whatever. You know, all I'm asking you is to be an observer, to try and unlock your eyes from your cell phones. All players need to be escorted to the bathroom. The best way to do this is with an adult. The way that I did it when I was managing 10 to 15 minutes before the game started, before the Little League pledge. They had already warmed up on the field. I had the team mom or one of the assistant coaches. We asked whoever had to go to the bathroom. They went together as a group, and then they were brought together as a group. It's for the safety of the kids, and at the same time it will prevent interruptions later in the game of somebody raising their hand and having to go to the bathroom. This is a view of the bathroom to the outside parking lot. Look how close it is. That's my car right there, not the one on the right. That one's a little nicer than mine. That's mine right there. But it's about 30 feet to the parking lot. This is an open campus. Anybody could park in here. There are people that live in the park. There are people that walk around in the park who we don't even know who they are. So again, this is an area, you know, there's no fence, there's no physical boundary. You want to keep your eyes open. Make sure that you're observant, who's around, what's going on, and, you know, it's all for the safety of our kids. Julia? Emergency field access. All right. There are two parts of the field where an ambulance can come in. One of them probably have never noticed. Right when you come off of Edinger and you're making a right or a left onto Graham going towards the park, directly on the right before you get to the tennis courts and racquetball courts, there is an open road. You see it there, guys? That actually is access to all fields by a medical vehicle. How many of you know what street the ballpark's on? Cross and Graham. Here's an easy way to remember this, and I'm going to tell you why you're going to need to remember this in a bit. Look at the sign. Isn't it kind of like a cross? One sign's like this and the other one's like this. It's Cross Street. You'll never forget it. You're coming down Cross Street towards the ballpark. This is the second vehicle entrance to the fields. This is the minor C field just to the right. This gate has full access to all fields by an emergency vehicle. Remember these two gates. Every field, this is an example here. This is the major field, has a gate large enough to allow an emergency vehicle to go onto the field. It's going to be a lot easier for somebody who's severely injured for the vehicle to go right on the field than to walk up and down our stadium stairs, tripping and stumbling over with the gurney and whatever else, you know, delaying the care of a significantly injured child. I recommend every field has this. Every manager should make certain that every lock on the field is unlocked prior to the start of the game. The lock is removed from the, don't just put the lock back on this area here, put it on the link so that when somebody wants to open up the gate, they don't have to futz around with moving the lock around. They just unlock it, unlatch it, and open it up and get that car in there, get the vehicle in there. Field parenting. This is important for the minor C parents. The minor C field is an open field. It does not have a circumventing outfield fence. It actually shares the field with Marina. I took this picture by standing on home plate on the minor C field. This here is a Marina ball player. Our kids are here hitting balls out into here. Their kids are hitting balls from there, sometimes hard line drives into where our kids are playing baseball. So the little dot F there is an area that's appropriate for a field parent. The field parent basically protects the ball players from balls that are flying from their field onto our field. Field parenting, very important, especially on minor C. All right, now we're going to get into the last part of the talk, examples of injury and intervention. I'm going to get some participation in this. All right, the first case I want to talk about is an injured catcher's throwing hand. Let's say there's a catcher who is struck by a ball in his throwing hand. You as the manager come out to assess the player. What type of things are you going to look for?
Swelling.
Swelling, good one.
Any movement in the hand?
Movement in the hand, two good ones.
Good way to tell is a handshake for the test of the grip.
Exactly. The other thing that you could do is to see if they can squeeze a ball. Because if they can't hold the ball, they can't throw the ball. So that's another way to do it, either hand grip or by gripping and throwing a ball to determine whether or not there's significant injury there or not. The other thing is the pain level. You guys talked about the movement, swelling, and so on. So let's just say that there's some significant swelling and pain. So what you want to do is you want to help the child over to the bench. Of course, they could take their mask off, whatever other equipment you need to take off for comfort, because all those other areas aren't affected. You can either have them sit or lay down on the bench. You can even pad their head to make them comfortable, put their hand up on their chest that's above their heart, ice to the area that's injured. Now the parent will probably already be down there, but also the manager will be there, your assistant coach, play will have been stopped, and there are certain things that need to be done. Number one is the safety of the child and taking care of the child. There are people that are there to help. Number one is there's an officer of the day that is there for every minute of every game. They take shifts and they are always there, and they need to be alerted of an injury. That eventually gets to the safety officer, who is a person that manages the the injury reports that are filled out on an injury. You have 24 hours to fill out a report on the injury status, on the injury that occurred on a specific date. The reason why it's important, the main reason is that if you don't do it, the kids won't be covered by the insurance that they get as a result of playing Little League Baseball. Every child that plays in our league is insured, whether or not they carry their own private insurance or not. Every child is insured. If there's any question about filling out an injury report, go ahead and do it. If there aren't any, now this child would likely need to go to the hospital because we're worried about a fracture, right? A broken thumb or any other myriad of injuries that can occur. In a catcher's hand, the ligaments around the thumb here can be injured. The base of the thumb here can be injured. I've taken care of a lot of kids who've actually broken this bone here, and I've had to put pins in and then put them into a cast. It's a very common area injured. But now what happens if there's no parent, or the kid is unable to walk or feels very wobbly? What are you going to do as a manager? If you think the child needs to be evaluated.
Well, if there's no parent, you need to call someone.
Who are you going to call?
We have a contact list, right? With parents.
911.
Depends how bad it is.
Well, the thing is exactly, but if you're considering where the child needs to go to the hospital to get an x-ray, and there isn't somebody there to take them, their parent or guardian, they'll have to be transported by an emergency vehicle. So you need to call 911. What I recommend is that every coach, every assistant coach, every team mom program into their phones 911, so that when something happens bad, you're not 911, oh wait, no, you not call, you have it there, you just push the button. It's already, ready dial, 911 and ready to go. But that's basically what you would need to do. So again, what's going to happen when you call 911? What are they going to ask you? They're going to ask you,
Where are you at?
where are you? Oh, we're at Robinwood. Where? Robinwood. You know, the park that sits kind of in the middle of a bunch of trees and you can't really see it? So what do you tell them? What street is it on? Crossing Graham. And you even know where the ambulances can enter if they ask you. right off of Edinger, cross dead ends. You can bring an ambulance in through those ways. You could have one of your managers or assistant managers actually meet them and escort them to the field. Again, you're speeding up the care of the child. So you guys are thinking very smart. If they ask you more questions, well, what else is around there? Well, the major intersection is Edinger and Graham. We're behind Marina High School. We share their grass. There is tennis courts. There's the Murphy Library. It's a little teeny library there. And there's actually a set of handball courts to just help dial them in even more. But as long as you know that it's Cross and Graham, they can localize that on a map, their GPS, and boom, they're there. Okay, this is a bad injury. This is something where everybody's going to be very concerned. Two outfielders, center fielder and right fielder, running as hard as they can. A ball's hit into the gap in between a line drive and a fly ball. Catchable. Both kids call for the ball. Both kids collide. Face first, face against face, chest against chest. Both kids have bloody faces. They fall to the ground. They're moving their arms and their legs. Both of them can communicate. They're talking. One of them sits up, but is confused as to what's going on. The player that remains down and is flat on their back complains of head and neck pain. What do you do?
911.
Okay, 911. Somebody should automatically be on the phone, right? Right away, you know it's a bad one. Okay, what else do you do?
Don't move them. Don't move them.
Excellent. Don't move them. What you can do to the child who is sitting up and is dazed and confused, you don't want him plopping down onto his back, but you can gently assist him back to laying down in a flat position. Is it okay to put like a sweatshirt or a little pillow under their head to make them more comfortable?
No.
Why?
You don't want to move their neck at all.
Correct. You don't want to move their neck. This has a high incidence of neck injury because both heads hit together. If you put something behind the neck and they have a swollen cord, the head is bent forward, it puts compression on the spinal cord and could lead to further injury. Now, because there's two players, you have to be really smart about this. You have to have one person attending one player, another person attending another player, and a third person making the 911 call. One person can't do all those things. One person can't attend to both ball players. So you probably have a manager, assistant manager, team mom or assistant coach doing the 911 calling. What about all the kids that are on the field? What do you do with them?
Put them in the dugouts.
Right, put them in the dugouts. We don't need them around there. We don't need them creating a crowd and a huddle around the injured kids. It's going to inhibit the accessibility of medical care. It's also going to create more anxiety in the kids in regards to their level of injury. One of the best things that you could do if as a manager and you go out there, the kid is conscious but is crying and is bloody and is worrying, is that you can tell them. One of the managers had one of the best statements last year, one of the junior managers. He said the thing that he always would tell a kid, he would say, you know what, the worst is over. You're going to be fine. We're taking care of you. What you're doing is you're allaying their anxiety. That in and of itself is one of the best things that you can do. You guys are all hitting everything, the nail on the head. You guys are a very, very good, astute group. There's some basic information you might also want to get on the kids. Sometimes when you make a 911 call, they're going to want to know the names of the players. So, you know, try to remember that if you can. Do you have the names, ages, things like that? I mean, it isn't absolutely mandatory to have that. Don't make that an absolute priority. The priority is getting somebody there to help out and that they know how many kids are injured so they could send enough help. So, but those are some of the other things that sometimes they try and ask for. Is it okay to give them a sip of water, or who says yes, who says no?
No.
Okay, why no?
before my surgeries, I was always NPO, so they said no drink.
Yeah.
Right, NPO, do you guys know what that stands for? Nothing per oral or mouth. That means you cannot have anything to eat or drink. The second that you give that child something to eat or drink, you have delayed the surgery that they may need by 8 hours. So absolutely nothing to eat or drink, no matter how thirsty they are, whatever else. So you want to continue just reassuring communication with the players. You got the other players sitting down out of the way. You got the 911 call going off. You have 2 adult managers and a coach, each monitoring, reassuring, and comforting each of the severely injured children. It's going to help a ton. So again, it's important. This isn't a time we're going to be wanting to run around to unlock gates, right? So you're going to want to make sure, like I said, before you start the game, unlock the gates, but make sure they're closed. Then they can just drive right up, open the gate, and pull right in and take care of the kid. You won't have to fumble for keys, and you'll save time. You guys are doing really well. I'm serious. All right, here's an injury that occurred last year. There's a batter at the plate, he's hit in the mouth. 2 of the front teeth are knocked out. The pain is to the mouth area only. What do you do?
It would be the same. I would call 911 again.
911. And what would you tell them?
I have a kid that was struck in the mouth with a baseball.
Okay, and then what else would you tell them?
Cross and Graham. Come down, cross. I'll let you in.
You're A minus. You're almost at an A. Okay, you also want to tell them that teeth were knocked out, and the reason is that and you want to tell them it's a dental emergency. The reason why it's a dental emergency is because those teeth can be replanted. You have about 1 hour from the time that the teeth are knocked out of the child's mouth to where he is taken in and the teeth are replanted, that they have a chance of growing back in and becoming viable again. So the best thing to do is, as big as the teeth are, how in the front, how small the insertion area is. So how easy it is for those to get knocked out. But they can be inserted right back. But here's what you do. That is, right, it's milk in a cup. So what you do is, you don't give them a drink of milk. Right. The snack bar always has milk up there. You go up there and get milk in a cup. One of your guys are going to be back looking for the teeth in the dirt. You put the teeth into the cup of milk, cover it if you can. That accompanies the child to the dentist for replantation. If, let's say, the milk is sour or they didn't change the quart over the last week, you could put it into cool water from the tap. It's almost as good as the milk. Oh, sorry, question?
Is it a good idea to clean the teeth if you're going to put them up, clean them with water first?
You know what? It's best to just put them in the milk. And I'll tell you the reason why. The reason is that if there's sand on the teeth, if you try and wipe it away or wash it away, especially around the root area, you can actually cause damage to the root area. It's best to just put it in the milk and let the dentist deal with it. He can clean it, he can inspect it, and he can do whatever he wants with it. The key is just to get the teeth into the milk. That's a very good question because they are going to have dirt on them. Okay, this is our last example. You guys have hung in there very well, but this is a good one, I think, because there's a lot of decision making. This is a common injury. You guys are going to be faced with stuff like this all the time. So let's say after sliding into second base, a player complains of some pain in his ankle. There's time called. Go out onto the field. Your guy is able to stand, but he walks with a little bit of a limp. You know, you're rubbing your chin a little bit like this, and you're checking him out to see if he's going to be able to